Mediweight is a medically supervised weight management program to help anybody with really small to large amounts of weight to lose weight and to maintain that weight loss in the longer term. Mediweight is different to most weight management programs out there at the moment because it's far more comprehensive. We recognise that it's a multifaceted problem, weight gain and weight management, and we need to address different components of it. So for example, we have the actual diet and physical weight loss, but we also have a specific psychological assessment to address quite complex issues with some people around their weight and why they're overweight, to help them to conquer those fears or worries or concerns so that they can in the longer term manage their weight and not just revert to the same sort of behaviour that led to the weight gain in the first place. I think many people are suitable for Mediweight. That's people with no obvious medical problems as yet that we're aware of, who just simply want to get rid of some weight and do it successfully and maintain it in the longer term. But I think it's also particularly suitable for people who've already got established medical conditions related to their weight, for example, high blood pressure, diabetes, fatty liver, all these things that can lead to long-term chronic ill health. We can treat those people, get the weight off them, and their health will improve considerably. We've had lots of patients who already have seen their type 2 diabetes disappear, having lost the weight, their fatty liver improve, their blood pressure come down and come off medication. So there really is a lot to gain in the longer term, health-wise, from completing the program. The foods that we use for Mediweight are based on some meal replacements, which consist of sachets of a high protein food in all different flavours, ranging from shakes and drinks through to soups, omelettes, and a range of solid food, both savoury and dessert. But that's not all you can eat on the programme. We also have an allowance of fresh food, salad, veg, fruit, even some white egg omelettes in there. So it isn't all about sachets. But what most people do really appreciate on the programme is that it is a very prescriptive programme, so you don't have to think too hard about it. You just do as we say, follow the plan, and it all happens. In order for us to monitor your progress on the programme, we have weekly visits. This is for two purposes. One is to carry out the two specific physical treatments that we use. One is low-frequency ultrasound, targeted at diet-resistant stubborn areas of fat, commonly, for example, on the tummy, to get rid of that and improve your body contour at the end. And the second treatment is the skin treatment called LPG, which helps to retract the skin and tone it up to stop you having loose skin at the end of the program. So that's one reason for a weekly visit. The other is your opportunity to speak to the therapist and the therapist to ask you questions to determine, first of all, that we have no safety issues around it, everything's going to plan, and for you to query about, it might be, for example, am I doing the right thing with the foods? Am I mixing them correctly? Can I combine certain foods together? Have I stuck with the right allowances for my salad, veg, fruit, or whatever? And any other problems that you may have. This is all reassuring for you as you go through the problem, the program, the regular contact, so that you know that things are going to plan. Before you commence on the Mediweight program, we'll do a thorough medical initial consultation. This is to allow us as the doctors to ensure that you are suitable for the program, and that if you do have specific medical conditions, that we can manage those satisfactorily throughout the program. For example, if you have diabetes, we may need to make adjustments to your medication because your calorie intake on the program will be considerably lower than normal. So you perhaps need to have a reduction of your treatment. It's also a chance for us to tell you in depth about the Mediweight program, how it works, how you need to do it, why it's important to comply, and what all the components are, and set goals for you to achieve. In addition to that, we will take a routine comprehensive blood screening test that we can identify any underlying problems, check that everything's safe, and we will go through everything in detail about you and the program. How fast you lose weight depends on many factors. In general terms, the bigger you are to start with, the faster you will lose the weight. Men will lose weight on average faster than women, and that's all related to metabolic rate and muscle mass. So big muscly men lose weight incredibly quickly. But to give you an average, we would expect over the course of the program for a person with a reasonable metabolic rate to lose approximately 1 stone per month. We make adjustments in our predictions for this according to the other medical factors that may determine how quickly you will lose weight, but we do try and give you an estimate of how long the program will last.